Well, thank you so much for inviting me. My name is Tracy Case. I am 54 years old. I have two children and a husband. My son is 24, my daughter's 21. I was originally diagnosed with invasive carcinoma breast cancer in 2001 when my son was 6 months old. Yeah, he was six, almost 9 months old. He was 9 months old when I had my surgery and stuff. And I actually just found the lump myself. I had an itch in my armpit. I felt it. It felt like a pee, a hard pee that kept rolling. Asked my husband, "What do you think this is?" And you better go get it checked out. And I was very fortunate that my doctor, his sister had just been diagnosed with breast cancer at a young age. So my gynecologist was like, I'm sending you to get a mammogram. And so they did the mammogram, couldn't find it. And so then they had to do the ultrasound where I showed them where it was, and they did a fine needle biopsy and determined that it was invasive ductal carcinoma. Uh, I know I don't have the gene. I got gene testing because my mom had breast cancer and she's still alive, but it never metastasized. So then go down, they told me that I should take tamoxifen. They said I didn't need chemo. And so I had a right side mastectomy. Did that, and then I did not take the tamoxifen. They told me that, and back then they didn't know what HER2 positive was. They did the fish test, but they didn't ever tell me I was HER2 positive. So I didn't take the tamoxifen because I wanted to have another baby. And my husband's 9 years older than me, so I made the decision not to take tamoxifen. Well, I was doing follow up down at MD Anderson, and I asked them if I could have another baby, and they said they didn't see why not. It had been almost 2 years, and so that's usually okay. But so I got pregnant with my daughter, and at 5 months, I started having sciatica pain, and they just attributed it to my pregnancy. And so I gave birth in September 22nd of 2003 to my daughter Taylor. And I got after I gave birth, I went to the restroom and I went to wipe, and spasms just shot up my back, and I just fell to the floor in pain. And we couldn't figure out what was wrong. And I went and got back in bed and went home. And I just kept calling my doctor. I'm in pain. I'm having pain. My back hurts. And they kept giving me like medicine. I wasn't breastfeeding. I was doing formula because I'd had the implants done and they were silicone as part of a study. So I wasn't breastfeeding. And so we were trying to figure out what was wrong. And then finally they sent me to a spine doctor, and he did an x-ray, and then they called me and said, we need an MRI. And so actually Halloween of 2003, I got my MRI, and then they called me like the next day or 2 days later, and my husband was in Dallas on a business trip, and they asked me if I could just come in and discuss the results. And I was like, okay, when do you want me to come in? They're like, you can come now. So I went in, and they just invited me straight back. And I really had no clue because I would have never, my husband wouldn't have left for Dallas if we had known that, if we had thought that something, I don't even know that I knew that it could metastasize. Like I don't know that any of that was there. Like that's probably ignorance was bliss. And then that's when they told me that it was actually November 4th. They told me that my cancer had spread to my bones. And then I called my doctor, MD Anderson, and they were like, this is in November, right? And they're like, well, we have an opening in February that you can come in. And I'm like, no, I'll be there tomorrow and I'll have everything with me. And so I went there, and then they did all the scans and everything like that. And they found that it had spread to my bones and my liver. And then that was so that was in 2003. And then I actually, I love MD Anderson. I go there now, but I was not happy with my doctor at MD Anderson. And they actually tried to get me to do a trial, and it wouldn't allow me to have Herceptin for the HER2 positive. And so a nurse actually told me that I couldn't repeat it, but she said, don't do this trial because you need this medicine. And so I switched doctors, and I went to a doctor, a smaller doctor. She had trained at MD Anderson, and then she opened her own practice. And so she was very aggressive, and I still had so much pain. I wasn't, I had like the vertebrae were kind of fractured from the tumors where those pressing on. So I wasn't allowed to lift my daughter. At this point, she was like 8 weeks old, maybe 10 weeks old. I don't remember, but I wasn't allowed to lift her, and so we had to get a bunch of help in, and so we actually got a nanny and everything too, and then Dr. Casimir had me do radiation and chemo, and so I did. That was back then in 2003, so I was Taxotere, Cytoxan, and carboplatin, and then Herceptin and Zometa, and then they gave me the shot for the to put you in menopause, and Aranesp and Procrit, all that stuff, and then radiation to my spine, and the radiation to my spine. Um, that was difficult. If you guys, some of you have probably had radiation, and that was probably harder than the chemo. And then actually, I had to do physical therapy because I couldn't really walk from all the steroids. Like they atrophied a lot of my face was huge, and they atrophied a lot of my muscles. And so at that point, they said that everything was looking good, but my liver wasn't responding. And so this was 2004. My liver wasn't responding as well as she wanted to. So she switched me to Navalbine and Zolota, but um, I was still taking Herceptin and Zometa and the shot for the menopause. But my period kept wanting to come back, and so I asked for a full hysterectomy with a oophorectomy too, because I just felt like there's this estrogen in the back of my mind. As long as I had those ovaries, I was going to have estrogen, and it didn't sit well with me. It caused me a lot of angst, and so they agreed to do that. I think that was in 2005. So, but anyway, to go back after I was on the Navalbine and Xeloda, that was able to get rid of my lesions in my liver. And at that point, the radiation, it takes a while to fully take effect. I was able to start walking and doing all my physical therapy and just kind of starting to reintegrate back into my family, my life. The nanny was taking care of my baby, and neighbors were taking care of my son. And then church friends and family were coming in, and I just drove myself to chemo. I didn't really like having people come with me because I felt like I had to entertain them, and sometimes I just wanted to sleep or listen to meditate or listen to something or crochet or do my Bible study. So now we're at 2005. I had my full hysterectomy, and I think that's right, and everything was going pretty good. And then I had a migraine one day, and it just like, I had to turn the lights out, and I didn't call the doctor because I'm like, she's gonna make me go have brain MRI, and I don't want to have brain MRI. So I was like, I'm not calling. And I just took some medicine, and then 2 weeks later, I got another headache, another migraine, and I was like, okay, I'm gonna have to call and get an MRI. So I had an MRI, and they found 3 lesions in my brain. And so my doctor sent me to one doctor, and he was like, immediately, you need to have full brain radiation. And he was very aggressive, very assertive. And just, I didn't feel good about it all. And they put me in the MRI to start or to start to ready the scan for the full brain radiation. And I had a panic attack, and I never panic. I'm like, I dream, I plan vacations, I pray in the MRI. It doesn't bother me being there. And so I pushed the button the first time in my life, and I said, get me out of here. And I called Dr. Casimir, and she said, I have another doctor. And so they sent me to this other doctor, and she actually had a doctor down. She worked with a doctor down at MD Anderson that was doing a trial for metastatic breast cancer to the brain, 3 lesions or less. And they had 2 legs of it. You could either do uh, stereotactic gamma knife surgery to the 3 lesions and follow it with full brain radiation, and then follow with MRIs, or you could do the stereotactic and just follow with the MRIs. And so I told them, well, first I told them, oh, I want to be super aggressive. Give me the whole thing. I want the full brain radiation. And I went home, thought about it, and I was like, no, I want to save full brain radiation for the future, because this is, like my doctor told me, this is a chronic illness. This is like the rest of my life that I'm going to deal with. And so I went back to him and I said, well, if you guys pull me as 3 and then watch it, then I'll do y'all's trial. And so that's what they pulled. And I underwent and so this was in 2005. I underwent the gamma knife stereotactic surgery. And and then went home. And then at that point, I was still just taking um, Zolota and Herceptin and Zometa, and I'd had the stereotactic. Then they were just watching me, and I think in January 2007, I think it was, I ran the Houston Half Marathon very slowly. But I did peer-to-peer support with a company called CanCare. And so it was a big fundraiser. So a friend of mine that's a runner, we raised like over $15,000, and she ran the full marathon, and I ran the half marathon. I thought I was going to die. And it was horrible. I'll never do it again. But I did that. That was like my fuck you, cancer, like I can do this. You're not gonna take me down, right? And then right after that, the doctor told me that one of the lesions had come back. Now I may have some of the time frames messed up, but so in 2007, they said one of the lesions had come back, and they wanted to remove it surgically. So I went and had a craniotomy, and they went in to remove it. They cut me here, and went in and tried to get the tumor out, and then they were testing it. But after the surgery, I was having a lot of pain in the hospital, and so then they took me back down to do an MRI. And they hadn't gotten it all, and so then the next day they had to go back in and do it again. And one of the things that made them do the MRI again was they had occupational therapists come in, and I had to go and make coffee. So they made me walk into the break room, and they told me where everything was, and they said, okay, make a pot of coffee. But I couldn't see the drawer, like wherever it was in my brain, anything like below my shoulder, like I couldn't see it. I couldn't find the coffee, and I couldn't find the coffee pot. I couldn't figure that out. And my mom helped me a little bit, and then so I failed the occupational therapy test. But so they went back in and they removed that. And so that was in 2009. And that was the last recurrence I've had, was 2009. No, I'm sorry, that was 2007. That was 2007. So in 2009, they told me I was no evidence of disease. And at that point, they moved me to Tykerb, which is now something like that. It's the HER2 positive pill. And so I've been taking that since then. And because it actually crosses the blood-brain barrier. So I've been taking that since 2009, and I just go for all my checks like it's finally gotten to where every 6 months, like I think it's April is my big tests, the brain MRI, all that stuff, and then in October it's usually my just my blood work, and then the doctor just checks me over. And they always say, they're like, if it's not broke, don't fix it, we're just going to leave you on here on everything you're taking. And they really don't know what to do with me. And I don't want to stop taking the medicine because I'm really scared that it's not. But you told me to ask why. I don't know why I survived and other people didn't. I've lost a lot of really good people to the disease. I'm sorry. And it's really hard because some of them, they're better people than me, like they never said a bad word about anybody. And I like to stir the pot a little bit. Like, I'm like, God, why are you like leaving me down here? And so I had a lot of survivor guilt a little bit that I had to work through and stuff like that. But one thing that I always tell people when I do my peer-to-peer support with my CanCare people, or like just in the stage 4 support group that I'm in, um, I tell them that the big thing is community, like just having a community around you, having people, a support network. I feel like, I've pretty much the whole time gone to support groups. There was a brief period when I moved from the Houston area to the Dallas area that I had the brief opportunity that nobody I met knew I had cancer. I wasn't that girl Tracy with cancer that everyone was praying for, and that strangers were bringing meals to. And it was a huge blessing, but it was also a huge burden too, right? Like I just wanted to be me at some point. I wanted to be able to not always talk about it, not always be reminded of it, I guess. But then I just started sharing with people because I feel like it's important. Hope, like that's one thing, is hope is such a big thing. And when my doctor MD Anderson, he never gave me hope. But the second I walked in to see Dr. Casimir, she looked at me and she said, Tracy, I have ladies 10, 11 years out, some even further with this cancer. She's like, it's a chronic illness. She said, like diabetes, like multiple sclerosis. She goes, so I don't ever, like, I know some people use the word terminal, and everyone has their own words that they use. I don't like that word terminal. Like, I know we're all terminal, we're all going to die one day. I like chronic illness. That's just my saying. But I think between hope, having support, um, I did everything that the doctors told me to. I did sometimes, like we had the stage 4 group back in 2007. We, started going to food co-ops because that was back when you couldn't get organic food. And so we would all meet up and go, and we started, like, I tried juicing. I've changed a lot of my products that I use on my skin because it's the biggest organ. I've gone through all those stages. I'm sure a lot of you have gone through where you're like, why do I have cancer? What is it that I can make myself not have cancer? What can I do to make it not come back? Maybe if I eat organic, or I, have a bunch of vitamin C. I thought about all that. I tried the raw food diet for like 3 days, and then I wanted to vomit when I looked at a salad. So that did not work for me. I like my meat. And so I don't know why I'm still here. I'm glad I'm still here. And I set little baby milestones because I'm interested to hear you guys' story too, if you guys are going to share some of it. But I think with having such small children, 6 weeks old and 3 years old, going through all of that, I just had to set little milestones for me because it was very scary. Like, I couldn't imagine that I wasn't going to be in their life. So I was like, okay, I just want to see Trent go to kindergarten. Okay, I just want to see Trent graduate from high school. Okay, I just want to see Trent go to college. And so now he's an adult, 24, has a good job. And my daughter's at college at Alabama. She's a junior. And now I just want to see them, if they decide to get married, I want to see them get married. I want to have grandbabies. And so I just kind of, that's my next milestone that I'm kind of setting for myself. But I don't think there's a magic pill, but those were just some of the things that I did in my life. And but I truly believe community and hope.